Hello, my name is Miss McLaughlin and I'm here to talk about BTEC Health and Social Care. The BTEC course is made up of three main components. Component 1 is Human Lifespan and Development. This is where students pick a celebrity or a person of interest and they explain how they develop physically, intellectually, emotionally and socially through three different life stages and the factors that can affect this. They then go on to look at a life event that has affected two different people and how valuable the support that they received in helping to adapt into those changes. Component 2 then is health and social care services and values. So students are given a case study that comprises of two individuals that have very different health and social care needs. They then research the local area and explain how those services can help meet the needs of those two individuals. They then go on to learn about the care values such as dignity, respect, duty of care, safeguarding and so on, and then they have to plan and demonstrate these care values in a given scenario. The scenarios generally you're helping an individual with mobility issues who lives in a residential home. Component 3 is health and wellbeing. So students have a scenario and what they look at is the different factors that can affect their health and wellbeing. Then they go on to look at physiological and lifestyle indicators such as BMI, peak flow readings, blood glucose levels. It could be blood pressure or even smoking habits. And what they do, they interpret it and explain how that can affect their health and wellbeing. They then go on to using this information, and what they'll do is design a health and wellbeing improvement plan, and then they'll explore the difficulties and barriers of implementing the plan and suggest ways to overcome them. For this course, if students opt in for Year 8 to start in Year 9, there'll be 2 lessons a week for 3 years. But then if students in Year 9 opt to start in Year 10, there'll be 3 lessons a week for 2 years. This is it, and the same content is covered. The exam board is Pearson. So BTEC Health and Social Care is made up of coursework and exam components. So there's 2 coursework components which make up 60% of the final grade. These are components 1 and 2. And then there's an exam component, which is component 3, and that's worth 40% of the final grade. There are 2 exam windows, which are in February and May, and it's worth 60 marks and they're given 2 hours to complete it. There is no tiers for the paper, so there's no higher or foundation tiers papers that you can find in some courses. There are 2 main grades that you can be given. Level 1 grades, which are at a pass and merit distinction, which is equivalent to GCSEs 1 to 3. Or there's level 2 grades, which is level 2 pass, merit distinction and distinction star, which is equivalent to GCSE grades 4 to 8.5. As you can see from this slide, there are many skills and qualities that students can develop or acquire when taking the health and social care course. I'm just going to go through a few of them. So, for example, students will need data analysis and math skills. So, for example, for the exam component 3, students may have to calculate BMI. They will definitely have to use graphs and data to interpret what it means and their effect on health and well-being. There'll be creativity. So, for example, students will need to plan and be creative on how to demonstrate the care values in component 2. And also creativity in the health and wellbeing improvement plan in component 3, the exam unit. There'll be teamwork. So when that comes about, component 2 is where students have to demonstrate care values, and they do this in pairs. So one individual is the care provider, and the other one is the service user. They need good time management skills because they'll need to meet deadlines for coursework. And for example, they will definitely have to use researching skills. So for example, they'll have to research services in the local area and also research about their celebrity in component 1 or person of interest, things that have happened in different life stages and the things that they experienced and what they went through. Okay, so here's what a couple of my Year 11 students say about health and social care. I'll just give you a moment or two to read those. These are students that took BTEC Level 2 Health and Social Care and also went on to BTEC Level 3 Health and Social Care and what they've gone on in their career. So, for example, Claudia has gone on to study nursing, Chantel's gone to study medicine, and Matthew has decided this year to go on to a degree in mental health nursing. And we're going to go into Matthew in more detail. Matthew studied Level 2 BTEC Health and Social Care at Christopher Hatton, and he was a fantastic student and was awarded a Distinction Star grade. Whilst he was studying his Level BTEC 2 course, he worked with myself and some other students at a residential care home with patients that mainly suffer with dementia. And since completing his Level 2 BTEC, he has stayed in the health and social care sector and he's experienced some fantastic things in the health and social care centre, and he's now decided to do a degree in mental health nursing. I'm going to give you a moment so you can have a read at the things he's been able to experience and use his Level 2 BTEC Health and Social Care course. So the Level 2 BTEC Health and Social Care can lead on to the Level 3 BTEC Nationals, which can prepare students to enter employment, apprenticeships, or move into higher education by studying a degree. Health and social care can lead into many, many different careers, such as social working, carers, teaching, occupational therapy, and even counselling. Frequently asked questions. So do students need to get the same grade for each component? So the BTEC used to be like this, but now each grade that they're given is given a certain amount of points, and those points then add up to get a particular grade, and this is discussed regularly with the students. Can students retake a component? So when it's a coursework, they can do a resubmission as long as it meets the criteria. That criteria is generally without any additional leading guidance from the teacher. And then if they need to resit an exam, this is generally given once. And then what will students cover in year 9 if they cannot start coursework? So the course starts in year 10, although students can opt in for it in year 9. So year 9 then cover the content of component 1, so that's the development through the life stages and the life events. And what they do, they practice applying the knowledge to an individual to prepare for the assessment in year 10. So if you need any further guidance or want some more information about health and social care, please contact myself, I'm Miss McLaughlin, or Miss Peter, she also teaches health and social care. Thank you, take care.